Hi everyone. Okay, nice to come to my channel. Okay, so this today we will discuss about the roots of medication administration. So in the last lecture we discussed about how to administer oral medications. Still remember, Diana?
Yes.
Yeah. So there medication administration means to give the medication, right?
Yes. Yes.
But when we give medications, there are different routes to give.
Yes.
So when we work as a nurse in the hospital, we have to give different types of medication to our patients. And there are a lot of different routes that we give the medication. So what means the routes of giving medication? That means through different ways.
Okay.
Yeah, so the route of medication administration means how do you give the medication to your patient? Yeah, there are all different ways to give. Yeah. So let's now have a discussion about different routes. Okay. So we know that the most common route of giving medication is through the mouth. Okay.
Yeah.
So we call it oral.
Oral.
Yeah, oral medication administration. So this way is you give the medication through the mouth. Yeah. So normally with oral medication we have different the medication are in different forms such as tablets. The tablets.
Yes.
Like the medication pill.
Yes.
Or capsules, right?
Yes.
Yeah,
The capsules. Yeah.
Capsules we
I remember.
discussed.
Yeah.
So different types. Different formats of the oral medication, like in tablets or capsules.
Capsules. Okay.
Yeah. So tablets are these little pills, that you give, and capsules are like the medication powder is covered by a shell, Okay. And then last time we discussed with tablets. Yeah. So if the patient cannot swallow properly, we can crush it into powder, or we can cut in half to make it easy to swallow. Yeah. Okay. So this is oral.
Oral.
Now. Next route I want to discuss is the topical. It's called topical.
Topical. Oh.
Yeah, topical.
Topical. Okay.
So what means topical? So topical means you give the medication through the skin.
Okay.
So like our skin has ability to absorb medication as well.
Okay.
So for example, some medication is designed as a cream or ointment. Okay. So like cream, or ointment,
okay,
or like lotions, like
lotion,
lotion,
yes,
yeah. So some medications are developed in a type of cream, ointment, or lotion. Like you have to apply this medication on the skin, so the skin can slowly absorb it. Yeah. So this way of giving medication is called topical.
Topical.
Yeah,
okay.
Topical.
Okay.
Yeah. And also our like for example other types like eye drops, ear drops.
Ear drops.
Yeah. So like for example you have like infection or some eye disorders and you need to have eye drops. So eye drop can be absorbed by the mucous membrane inside the eye. So in that case, it is also called topical.
Oh, okay.
Yes, like that. So sometimes when doctor write the medication order on the medication chart, we say, doctor will write a route as topical. So if you see topical, you understand the medication should be absorbed by the skin. Or the mucous membrane. Like that in the eyes, like that. Okay.
Okay.
Yeah. So our skin has the ability to absorb the medication. Okay. Now third route I want to discuss is the the injections.
Okay.
Injections. Like like apart from the oral route, all the other routes that we give like through the injections is called a parenteral route. Parenteral route.
Oh.
Yeah, parenteral medication administration.
Parental.
Yeah.
Okay.
Like, sorry, I'll just, Yeah, so the other, like, all the other routes of giving medication apart from the oral route is called parenteral route, like through the injections.
Okay.
Yeah, so now let's discuss about different ways of giving the injections. Okay? So
Okay.
injectable medications.
Yeah.
There are different ways of giving the injections. The first way, like, what is injection? So injection means like you give the medication through, like, by a needle, right? So you use a syringe. The syringe needs to be attached to a needle. You know the syringe?
Yes.
The syringe, like, attached to the needle, and we use that to inject into the patient's body to give the medications, right? Yeah. So there are different type of injections. The first type we call it intramuscular injection.
Intramuscular injection.
Yeah. Intramuscular injection. Okay. Okay. So intramuscular injection. Intra means into.
Okay.
Inside.
Okay.
Muscular means muscle.
Okay.
So intramuscular injection means the needle go inside your muscle. Yeah, because your muscle can absorb the medication. Okay. So where is your muscle located? So when we talk about like our skin, right?
Yeah.
So we have like different layer of the skin, right?
Yes.
So we have like first layer epidermis, then dermis, and then underneath dermis we have subcutaneous tissue, and then underneath subcutaneous tissue we have the muscle, muscle, tendon, like those. Yeah. So your muscle is located underneath your skin layers, deep inside. Okay. Underneath your skin layers. So if we inject give the injection, put the needle inside the muscle, and then inject the medication into the muscle, this is called intramuscular injection. Intramuscular. Yeah. Like, what are some medication we give through the muscle? Because our muscle contains like rich blood vessels as well, so it can quickly absorb the medication, right? So this way is very quick, so make the medication quickly absorbed.
Okay.
For example, the most common medication we give into the muscle is the vaccinations.
Yeah.
Those vaccinations, like
Yes.
flu vaccination,
Yes.
like different type of
the
to
COVID,
help to prevent influenza, certain infectious diseases, right? So like normally the vaccinations are given through this intramuscular route.
Okay.
So remember this terminology. Okay.
Yeah.
Okay. Next one I want to talk about is it's called subcutaneous injection. Subcutaneous injection. Yeah, subcutaneous injection. So the short term for subcutaneous injection is S/C. Subcut. Some people can say give the subcut. That means subcutaneous injection.
Okay.
Now intramuscular injection, the short term is IM. IM. If we say give this medication through the IM route, that means intramuscular.
Okay.
But if I say give the medication through the subcutaneous route, this is called subcut. S/C, subcut. Okay. That's the short term. Now, what means subcutaneous injection? So you can see the word subcutaneous. That means the injection goes into subcutaneous tissue. Okay. Subcutaneous tissue. So think about our skin again.
Yep.
So our skin contains 3 layers, right?
Yes.
Yeah. So the skin, this is our skin.
Yes.
Skin. Now it has 3 layers. It has 3 layers. So the first layer is called epidermis.
Epidermis.
Yeah, epidermis.
Yes.
Epidermis. Okay, that's the first layer of our skin.
Now
the second layer is called dermis.
Okay.
Dermis. Okay, dermis. So epidermis is a superficial layer of the skin, the very top layer of the skin. Epidermis doesn't have any nerve or blood vessels. So if you peel the epidermis, you won't bleed and you won't feel pain.
Okay.
But underneath epidermis, we have the dermis. So dermis layer contains rich nerves, contains the rich blood vessels, also contains like some other glands, like sweat glands, hair follicles, like that. So the hair grows from this dermis as well, right? So so this is second layer of the skin is called dermis. Dermis. Okay. Now the third layer, underneath dermis, we have that tissue called subcutaneous tissue. Okay.
Okay.
So subcutaneous tissue. Subcutaneous tissue contains mostly the fatty tissue. Contains fatty tissue. Okay, so it's made of fat. So so subcutaneous tissue contains fat. Yeah, the fat. It's a tissue that helps us to store the fat. The fatty cells is called adipose. The fatty tissue is also called adipose tissues. Yeah. Okay. So now you understand the different, three major layers of the skin. Okay? So when I say subcutaneous injection, that means we give the medication, we give this injection into the subcutaneous tissue.
Okay.
Yeah. So we inject needles. Pierce through the epidermis and then into the subcutaneous tissue.
Okay.
Now, in the subcutaneous tissue, it has again good blood vessels. It contains blood vessels. It contains like rich fatty cells, fatty tissues. So it can also absorb the medication well. Okay. The subcutaneous tissue, because it contains more fatty tissues and it contains blood vessels, so it can quickly absorb the medications. Okay, so that's why this is a very common route of giving medication. Okay, understand? Okay. So now you have a clear understanding about different layer of the skin, right? And where is subcutaneous tissue and why do we give injection into this tissue? Because it can properly absorb medication.
Okay.
So that's this one. Later on, I'll probably ask some questions. Yeah.
Okay.
Okay. Yeah. Now, you can think of like these two routes. Intramuscular is into the muscle.
Yeah.
Now, where is muscle? Muscle tissue is located underneath subcutaneous tissue.
Okay.
Yeah, understand?
Okay.
Yeah. So now we have, for example, this is subcutaneous tissue.
Yeah.
Subcutaneous. Tissue, and then muscle is located underneath. So this will be the muscle. Okay. So muscle is deeply located deeply underneath the subcutaneous tissue, right? So the first layer is dermis, and then first layer is epidermis. Dermis. And then we have what? Dermis. And then we have subcutaneous tissue. Then underneath is muscle. Okay. Muscle. Okay. So muscle is located deeper inside. So now we understand the different layers of the skin. Now, when we give these injections, now we know that we give with an angle, isn't it? We get we have a syringe attached to the needle and then we give medication. So we draw the medication. If the medication is in a liquid format, so we draw the medication through the vial or ampule, right, with a syringe.
Yes.
And then we have to inject this medication into either muscle or subcutaneous tissue, right? So this through these injections. So when we give subcutaneous injection, because it goes to subcutaneous tissue is not as deep as muscle. So what is the angle? When we give the needle, we have to have an angle, isn't it? Angle
Yes,
of the needle.
yeah.
So subcutaneous injection, normally we choose like smaller needle,
Okay.
like shorter and smaller needle.
Okay.
Because subcutaneous tissue is not that deep, right?
Yeah.
So we use a smaller and shorter needle, and we can do like say 45, 60 degree when we
Okay.
inject.
Okay.
Yeah. Yeah.
Okay.
But however, if we need to give intramuscular injection, because muscle is located quite deep inside, right? So we have to choose a bit what needle, what size of needle, a bit longer needle, right? A bit longer needle, a bit thicker the needle. And when we inject, we have to inject with a 90-degree angle.
Okay.
Yeah. So like like
90. Okay.
you understand this is a needle, right?
Yes.
So, yeah, so this is a needle with a syringe, okay? So when we give if this is a muscle because it's quite deep, so we just, needle goes to 90 degree like this, yeah, the needle, right?
Yes.
And we use like a longer needle and larger needle, so it can make the muscle properly absorb, right? The needle can reach the muscle,
Yes.
yeah, properly. Now with subcutaneous injection, because subcutaneous tissue is not that deep, okay, so we use like shorter needle, thinner needle, and you can use 45 or 60 degree instead of 90 degree.
Yes.
Yeah. But depending on how much subcutaneous tissue this patient has. Some people have some people they have big size.
Yes.
Right? So their subcutaneous tissue is very thick, right? So in this case, you can just give 90 degree. Yeah, do 90 degree.
Okay.
Yeah. Now for some very slim patients, some patients they're very slim, they're very thin. They don't have enough subcutaneous tissue, right? So when you give them, you choose like smaller needle, like with 45 degree.
Okay.
Yeah. So depending on the size of the patient.
Okay.
Yeah, also depending on, like the needle size, right? Okay. Have a better understanding?
Yes.
Yeah, okay. And then one more. Okay. One more route I want to discuss is another type of injections. Okay. This is called IV.
Okay.
IV. So it's called intravenous.
Yeah.
Yeah. Intravenous injection. Okay. Yeah. Intravenous. What means intravenous? What is venous? Venous is our vein. Vein. Yeah.
Okay.
Veins.
Okay.
So vein is one type of our blood vessels, right?
Yes.
So we have a lot of blood vessels. The blood vessels in our body helps to deliver the blood.
Yes.
Yeah. With blood vessels, we have two types. The major two types: artery and vein.
Artery.
Yeah. So
yes.
blood vessels. Okay. We have artery, artery and vein. Okay. These major two types. So artery is a blood vessel that carries blood with rich oxygen. Okay?
Okay.
So when the heart contract and pump out the blood will be carried by the arteries to rest of the body to provide oxygen. Yeah. Now vein is the blood vessel that contains poor oxygen. Vein. And vein carries the blood from rest of the body back to the heart. Back to the heart. Okay?
Okay.
So this is your heart. This is heart. Heart pumps out blood through the artery.
Yes.
So this is artery, right?
Yeah.
And then collect blood back from rest of the body through the vein. Okay?
Okay.
Yeah, the vein. Yeah. And this is artery. Okay? So when the heart pumps, the heart sends the blood with rich oxygen through the artery. Supply to rest of the body to be used. Yeah, for the oxygen to be used. And after the body uses oxygen, the blood will send back through the vein and then back to the heart. Yeah. So now when we say intravenous, that means inside the vein. Yeah.
Okay.
So we can also give the medications, into the veins.
Okay.
Yeah, you know the vein, because vein is one type of blood vessel, right?
Yes.
So if we give the medication, if we directly inject the medication into the veins, right? The medication can directly be absorbed by the blood.
Okay.
Yeah? So the blood can, send this medication, can carry this medication, and then the medication can be quickly absorbed and then take effect in the bloodstream. So from the bloodstream, the medication will flow to the target organ and tissue and then take effect. Okay?
Yeah.
So now, these are the main, very, very important 3 types of injection that we discussed. Yeah. So intramuscular is a medication given into the muscle. Subcutaneous injection is medication given into the subcutaneous tissue. Intravenous injection is a medication given into the vein. Directly go to the blood. And blood carry oxygen. Blood carry this medication and then to take effect. Yeah.
Okay.
So now, which route do you think is the fastest route?
I think it's the three.
The third one, intravenous. So you think about when we give injections that through the different routes. Think about the rate of the absorption. So which route absorbs very fast? Definitely this route, intravenous. Because think about if your medication directly flow into blood, it can quickly spread, quickly take effect, isn't it?
Yes.
Yeah. So intravenous injection is the fastest route. It can quickly take effect. So if the patient have any critical health conditions, we give intravenous medications. Give the medication into the vein, okay, and then can quickly be used, right?
Yes.
And then intramuscular is the second fast route.
Yes.
Okay? Because muscle can absorb medication as well, fast as well, but not as fast as this one. Okay?
Yes.
And then after intramuscular, and then we have subcutaneous injection.
Yeah.
So intravenous is the fastest, and then followed by intramuscular, and then the last one is subcutaneous injection.
Okay.
So let's understand the rate of injection. Yeah. Think about which route works fast, which route works not that fast. Okay. So that's different type of injections we discussed. Yeah. With intravenous, the short term is called IV. IV. So when the RN says give IV medication, that means we give medication through the vein.
Okay.
Yeah.
Okay.
And some other types of giving medications. Another one I want to say is it's called transdermal. Transdermal. Yeah, this way. Yeah. Transdermal route is like similar with like topical. It's like give the medication as a patch. As a patch.
Okay.
Yeah. So do you know that like some medication can be designed as a patch and we stick onto the skin. The skin can absorb it.
Okay.
Yeah. So it's similar with topical. It's like but that different form of medication. So the topical is like designed as a cream, right? So skin can absorb. But transdermal is like designed as a patch. So patch is like a sticker, isn't it? So the medication is stored in this patch, and you apply this patch onto the skin, okay? And then make the skin to absorb the medication. So transdermal. Transdermal. This is another route. Okay. This is another route. I think now so these are some common routes of giving the medications. So if we work as a nurse, like we have to understand what routes that doctor wants this patient to receive the medication. And then we have to really strictly follow the correct route. Make sure, because doctor write the medication order on the medication chart. Now these days, a lot of hospitals have updated to the digital system. It's called an electronic medical system, right? EMR, the digital system. So sometimes the doctor just write an order on the computer, right?
Yeah.
So you don't need to have like paper chart, but
Mm.
same thing, you have to follow that order. Have you
Yeah.
clearly understand what route you have to give to this medication?
Okay.
Yes. For example, doctor ordered the injection, but you give oral.
Mhm.
That's a medication mistake.
Mm.
Yeah. If doctor ordered like the cream, but you give like injection. So like depending on what route doctor wants, you have to follow that route.
Yes.
All clear? So
Yes.
so that's all for today. Just
Okay.
discuss some common rules of giving medications.
Okay.
Understand?
Yes. Thank you.
Oh, good.